This is Rachel Dworkin from the Chemung County Historical Society. Today is April 6th, 2021, and I am here speaking with
Mary Ryan.
Okay, this is for the COVID Memory Project. Mary, I understand you are a nurse. Could you tell us where you work and what you do?
I've been a nurse for 47 plus years. I work here in Elmira. It's Arnett Health. The hospitals combined a little while ago, but they maintain two campuses. But I work actually at both campuses. Right now I'm a nursing supervisor. But I also spent 12, 13 years in the ER and ICUs at Arnett and St. Joe's, and I've worked at Ira Davenport before. It's all been critical care. I also do some teaching. I work for community health, which Arnett and St. Joe's take some of their programs out, like to the farmers markets and such, and does health screenings. But we haven't done any last year. Hopefully we'll get going again this year.
Okay. Can you tell us how COVID has impacted your work through the hospitals?
It's been huge. I retired a couple years ago. I'm not the type to sit home. I did it for a couple weeks and said, okay, I'm bored. I've always been a nurse. So I went back to work per diem. And I worked for 2 years. And I was just about ready to make my hours shorter, work fewer days. And when we started hearing about this COVID a year ago, maybe February, and from that moment on, my hours increased tremendously per my own acknowledgement, because the hospitals needed us. There were the beginnings of the hotlines. They wanted those staffed with nurses. There were just hospital questions everywhere. There was testing. All this was just such a gray area. So I started out in the midst of that, still continuing to be a nursing supervisor, but doing teaching, testing all the residents. We have 2 at St. Joe's. We have a 4 separate unit skilled nursing facility. So that fell under different rules than, say, the other hospital parts. Learning to do that. Dealing with the end of visitation with families. And we actually had a COVID unit open on St. Joe's campus. And we learned a million years ago in college all of the infection prevention criteria and PPE and all that stuff. And we actually took training after 9/11 the nurses took training about pandemics. And I remember sitting there thinking, well, I don't know. Well, it was a strange feeling to realize that. And I think when the first time I realized it is when you're at home and you think, there's no place to go. There's no place I want to go. I don't want this. I don't want any of my family to get it. I don't want any part of it. So from that moment on, I basically went home. I have family here in town. I did not see any of them. And we're barely now. My brother's vaccinated also. My sister lives in New Hampshire. But it changed. Even coming to work every single day, there was new information. Some of it was, okay, what you learned yesterday, never mind. This is what we're going to do today. This is how we're going to manage it today. You must wear this mask, this face shield, this PPE. Tomorrow, it was different. It was a challenge every single day. Not only to deal with my basic job as nursing supervision with staff, but how to put all of this confusion-ish into an 8, 10, 12-hour shift so that the residents weren't scared. The other patients in the hospital weren't scared. Why do you have all this stuff on? What is going on? Why can't I see my family? And that challenge is still there today. The changes every day to all the regulations are fewer But I still go in every day with okay, what part of this are we dealing with? And we're far from over.
So, in terms of PPE, was there enough at the hospital where you were working? I know you see pictures online of nurses in trash bags because they didn't have gowns. Was that an issue here?
To a small extent. We didn't have to wear trash bags. We had, and both hospitals had, the adequate amount of gowns. The N95 mask, the specific fit masks, were in short supply, and that was everywhere. So we sometimes had to wear them 2 and 3 days. We would take them off each day, put them in a little paper bag, put our name on them, and put them back on. If indeed they became bent or unusable or anything, we would get a new one, but the masks were kept in the administrative offices in both hospitals. And we couldn't just go to a supply closet and pull out a box of masks. Everything was counted. There was concern over wearing the masks a couple, 3 days, because if you wear one for 8 hours with this, plus goggles and a face shield, you normally sweat. Mm-hmm. Like if you wear glasses, you go up underneath the glasses, the nose piece changes, your face sweats and stuff. They didn't stay nice and neat for more than maybe 2 or 3 days. But I know that a lot of what we had at St. Joe's went to Ardent because they dealt with so many more patients, especially in intensive care. And their, especially if they were on ventilators, their PPE was fresh every day. Absolutely fresh every day.
So you weren't working with COVID cases the way that they were at Arnott, or were you?
They had the ventilated patients.
Okay. So
they had the ventilated patients, but you still wear the same.
There were but non-ventilated COVID patients at St. Joe's where you were working?
Yes.
Can you tell me a little bit about like numbers and how it was different from the way that ventilated patients were being treated?
We had fewer. I would say we had fewer than 10, but we had to open a special unit. The exposure to these skilled nursing residents more than likely possibly came from staff. There were no visitors at the time. There was no exposure to any family members or anything. They were all in the special rooms, the negative pressure rooms, which means it takes the air out. They were in a separate private room each. They had a lot of the physical symptoms, fever, chills, a little bit of a fogginess is what they called it. Some had vomiting, some had diarrhea, some had just plain stomach pain, extreme exhaustion. Our patients, and they were up there in age, never progressed to the awful pneumonia, which would then place them at the Arnott. And then if they couldn't maintain an oxygen level at all, they were placed on a ventilator. That's when it was like, are they going to be able to come off or not? Because of the damage to the lungs by that time was so bad. But knock on wood, our little gang, they were sick for quite a while, but they rallied.
Okay.
Some have a couple small residual things, but then I know a lot of my friends and coworkers that had COVID themselves and still are having residual symptoms.
How many of the nursing staff at the hospital wound up contracting COVID?
I don't know the exact number. I really don't know the exact number. It was a good percentage. Nothing that kept us from lesser care due to staffing. We always had enough staffing. The per diems all stepped up. All of us stepped up. I really don't know the percentage, but it was a good amount. And this was more so last year, last fall, last winter, even a little until January this year, that had it. Other people, got it on the outside and were not able to escape it in some places. but I don't know the exact percentage.
So were you guys regularly tested, or?
Absolutely. According to the governor and skilled nursing, they're tested once a week, and the residents were tested once, and that still is in effect.
Okay. You had mentioned when we talked before we started recording that you were involved in vaccination clinics.
Absolutely.
Can you tell me a little bit about that?
I started with the first one a couple months ago. I work also for Community Health, which is part of Arnott and St. Joe's. And it was Pfizer and Moderna. It was second dose Pfizer, first dose Moderna. They're very well run. The complicated part is getting the exact information from the person that's going to get the shot. There's things we need to know immediately. Have you ever had a violent anaphylactic, meaning stop breathing, reaction to a shot, flu shot, anything like that? If that's a yes, they're not going to get it. They're not going to, unless the doctor feels so positive. But have you had a flu shot, shingle shot, any of those shots prior to 2 weeks before? If you're going to have other of those shots afterwards, you have to wait a certain time. Do you get rashes? What medications do you take? And all that's on a standard questionnaire that everyone gets. I know when they register, a lot of the registrations taking place on the 6th floor at St. Joe's. I didn't know that, but the old MIS room is now filled with people up there. Excuse me, and that's a basic 2-page questionnaire. They're free. The shots are totally free. And I gave second dose Modernas also. I myself had Pfizer back in the beginning, and it was probably, I'm going to cough here, maybe a month and a half ago when Johnson & Johnson hit town. And I did 2 there. We were able to also give them to the Arnott patients, St. Joe's patients, discharged patients, admitted patients. So we gave them both hospitals, and I did a huge clinic at the Family Fitness Center.
So who is mostly attending these clinics?
At first it was, first of all, it was employees of all 3 hospitals. It was any healthcare provider from the nursing homes, anywhere like that. Paramedics, firemen, undertakers, believe it or not. Mostly medical personnel and people that dealt with the public day after day, face to face. Initially. Now, since they lowered it to 50, there's a good amount of that age people finally coming forward for shots. Now, as of tomorrow, it's 16. So we'll see how that goes, because I hear and I work with and a lot of people who they're not sure they're going to get it. They don't want it at this point, because we're giving more Johnson & Johnson as we speak, and then there's a big clinic today and tomorrow, and next week I'll be doing some more clinics. So it's a good turnout everywhere. Teachers were back in the first wave. Anyone over 65 with what they call it a comorbidity, meaning high blood pressure, heart disease, anything like that makes your immune system susceptible. But I see younger people now.
Okay. So how are they getting the word out about these clinics? Is it just that you go and you show up and you say, here we are, come get your shots, or is it advertised online?
It's advertised. It all has to be pre-registered. You have to have that little form filled out and a pre-registered visit. Say, okay, you come at 1:15, 1:30, and that's what all the phone banks are doing. It's online, it's on television, it's on Facebook, it's on Instagram. It goes along the bottom of both Channel 18 and Channel 36 News. It's on the community calendar, a lot. And then, especially when they developed the one a while ago for it, then they realized you know, this age group that we're giving shots to probably don't all have computers and access to that. So the Department of Aging set up a program that if you do not have access to a computer or you can't use it well or anything, call this number. And they set up a huge amount. They are also giving shots too. Arnett is giving shots. It's all on any social media, television, and anywhere you can, the newspapers. And the problem is people think that if they don't have a computer, well, I can't get a shot. Well, you can now. You know, there's plenty of, you call this number and they will register you through whatever place you go to get the shot. I know I've gone to two. My brother had his, he's legally blind, at the Aviation Center. And those were run by the county. And I think the first day we went for his first shot, they gave 650. And then we went back the 4 weeks, which was just last. So, as smooth as they're all very smooth, very smooth.
Okay. So you had talked a little bit about the impact of the pandemic on your social life in the sense that you basically become a hermit, except for work. Could you elaborate on that a little bit? Like how did it affect your daily life and how you go about doing things?
Well, I even was, I won't say nervous, but there's just myself. So I'm thinking, most of my family and my friends are kind of my age-ish, so they're not going to be running around going to stores. Groceries was one thing, but I live near Weiss, so I would go in, get what I need, and come back. I belong to the Women's Hibernians. I belong to a couple other groups that meet weekly and stuff. We went to Zoom. The Hibernians we didn't right away, but we have since. Phone calls. My sister usually visits from New Hampshire. I'm usually up there a couple times. She's a retired school teacher, and no travel anywhere. And the biggest, last year, August 3rd, I was scheduled with about 38 other people for a trip to Ireland. 14 days, tickets to the Notre Dame Navy game, all over the country. A pet cane tour was canceled. Rescheduled for this June, which has since been canceled. So those are my biggest, I still look, I've never been, my cousin and I were going, so that was hard. We love to go to the movies. We just go sit and socialize with my friends. I have a lot of friends in Hammondsport because I grew up there. We would go, spend the evening at someone's house, a whole bunch of people together. That all just ended. But basically, all the things at book club, we just didn't leave the house. We Zoomed. I learned about Zoom. I'm not too computer savvy, but so far so good. Bless you. Visiting family, traveling, that was all gone. It was a family wedding, big family wedding in June in Cleveland. They got married on the front lawn, and everybody watched on Facebook. Now, hopefully, the reception is at the end of May. So I have reservations, my brother and I, to go out there to Cleveland. So all that just kind of stopped. My niece and nephew, my little precious niece and nephew, I didn't dare see them because I was working directly with it. There was no vaccine up until just a while ago. They were 10 and 6, and I thought and their parents, I absolutely will not take that risk of giving it. I have a 93-year-old uncle, so I just basically everything that I love to do. I mean, you could still do it via Zoom, but
it's not the same.
Not the same, not the same.
Okay. Do you have any other thoughts about how the pandemic has impacted your life or your work or the community?
I think that the thing that really, you read people say, how much longer do I have to wear this mask? I can't wait till we get back to normal. I think the thing that it's made me realize is, and you hear this all the time, but until you actually work with it, normal what was is not going to be normal what is. I don't think I'll ever feel tremendously comfortable in a great big huge crowd of people pushed together, like St. Patrick's Day used to be huge. Sports events, and they can carry it. And it's made me think that I'm going to always probably keep masks around. I mean, look at the flu season. We sailed through that. And that was a blessing because some of our residents would get the flu and horribly, horribly sick. As far as nursing, it's made all that stuff that we trained for all those years, especially after 9/11, come forward and think this is how we're going to have to operate from now on. There are going to be other viruses. There's going to be other spreading things. And it's a huge wake-up call. What was normal isn't going to be normal anymore. And I hope the community, I mean, it's not that we can't ever get back together in a group or anything, but just pay attention to it. And I see where I live, I see a lot of activity with no masks, and they're not young enough, or they're not old enough to get vaccines until tomorrow. So that concerns me. But as far as the community goes and my work, and we're going to probably have to operate on a much, smaller scale from now on.
Okay.
From now on.
Anything else you'd like to add?
No, just please, if you can, get vaccinated.
You cannot
get, it is not a live virus. It does not give you COVID. It gives your immune system one heck of a jolt, and that's what these side effects are coming from. They as fast as they come on, they will go away. Just get vaccinated and continue to wear a mask until, if you feel comfortable wearing a mask, I think people are going to wear them from now on. I mean, we kind of get used to the feeling of it on our face, and if we don't have it on, it's like, oh, where's my mask?
Yeah. All right. Well, thank you very much for speaking with me.
You're very welcome.